Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. And I would like to start again by thanking the scientific and the organizing committee for this invitation. And thank you for being here in the last session of today. So I had a discussion with Dr. Muhammad just prior to the Eid holidays on what topic I should be presenting. And we were always discussing about disaster preparedness and blood banking. And he thought that that's an interesting topic to discuss. And literally while I was preparing for this, Oman did had a disaster, which you all have heard with over the past week. And that actually made me think that this is really a topic that should be discussed very frequently than what we usually should do. So what did he ask me to do is to really present on how we as blood banks should prepare ourselves to disasters, how that should be within the national system for that purpose. And there are really very good resources that are present out there, which I will allude to in this presentation. So without any further ado, I don't have any conflict of interest to disclose. I worked with it in the disaster committee in my hospital, so we worked in a disaster plan. But that was all what I can disclose for now. So we know that disasters disturb the infrastructure, and it can deter donors. That can be due to fear of illness, like what we've talked yesterday about in COVID. And it also overburdened the overall healthcare system. It makes it very difficult to maintain healthcare, including blood supplies. And there are always these ethical questions that comes in when a country goes through a disaster, and this is related to equity of healthcare in the midstorm of a disaster. The obligation of providing the healthcare services is there, also the requirement of rescuing those who are impacted by the disaster is there, but at the same time, you have to continue the clinical care for patients and also try and keep the circumstances safe for the public as well as for your donors and staff. And the blood services should have a well-defined integral role in emergency preparedness and response to ensure the availability of safe blood. So the ABB does report these definitions for disaster. It can be a domestic disaster, it can be an act or tourism that can suddenly cause a requirement of large amount of blood than what is a normal requirement. It can also temporarily restrict or eliminate a blood collector's ability to collect, test, processes, and distributes blood. Or it can temporarily restrict or prevent a local population from blood donation. And that's basically what we have seen, for instance, in COVID, and can be seen in many natural disasters too. Or it can literally cause a sudden influx of donors requiring accelerated blood donation to meet an emergent need elsewhere. And we commonly see this, for example, after earthquakes, like what we have seen in the past couple of years in Turkey, for example. And there are different types of disasters. So disasters can be natural, including hurricanes, tropical storms, tsunamis, earthquakes, floods, and so forth. And really the difficulty within this disaster scenario is that the first 24, 48 hours is really critical in order to maximize the retrieval of any health issues and saving lives of those who are impacted by the disaster. So it's really a very critical time frame for rescuing patients. Disasters can be also man-made, and this can include armed conflicts, industrial explosions, transportation events like train accidents. It can also include IT failures and cybersecurity attacks. And we don't often think of that, but actually this is an important component that we should think of in blood banks and healthcare systems as part of disasters. And there are also complex and hybrid disasters, and we talked a little bit about this yesterday with COVID-19 pandemic. It's an example of a hybrid disaster that has multiple impacts on the healthcare system, and COVID by itself considered as one of the deadliest pandemics that have been seen in humanity, and it caused more than 6.5 million deaths in less than 3 years. So what's the impact of disasters? It does have an impact on decreasing the ability to collect, test, process, and distribute blood. It limits the access to testing. It increases the demand for blood, for example, in traumatic patients, and as well as your normal patients, like obstetric patients, patients with hematological disorders, hemoglobinopathies, and even cancers. It can cause a sudden influx of donors that can exceed the capacity of a blood bank to control. It compromises the management of many patients, including pediatric patients, especially in low and middle income countries where nutritional anemia is very common. And it can lead to a loss of trust in the healthcare system if the disaster overburdened the healthcare, leading to additional life losses, not due to the disaster itself, but because of inability of providing care for other patients. And this report actually does show that there has been an increase in the trends of disasters over the past few years. You can see here that, for instance, disasters numbers has basically increased since the 1970s. This database excludes the COVID-19 pandemic. And you can also see that these disasters do impact different regions worldwide. So Asia Pacific, followed by the Americans, and that's basically because of the hurricanes and the tornadoes that affects these continents, tends to be the highest in terms of rates of disasters. You could see, however, that there is a difference even with the number of deaths from these disasters that impacts mainly Asia Pacific and Africa, as well as the number of patients or people that are affected by disasters also higher in these countries. And that really reflects not only the magnitude of the disaster, but also the infrastructure in some of the countries in managing and dealing with these disasters. And if you can see here, we actually are ranked third as the Middle East and North Africa in terms of number of people that are affected by disasters. The other thing that is important to remember is that disasters that are due to climate change are increasing. And I gave yesterday examples of that, of what we are seeing back home. But these are really the trends that you are seeing, not only in a certain region, but it is basically worldwide. And you can also see that it's also multiple disasters. So countries or number of countries that are exposed to multiple disasters at the same time is increasing. And the example of that can be, for instance, having COVID plus an additional disaster that strikes in the middle of it. And that really can overcome, the capacity of the healthcare system to handle. So when it comes into blood supply, the systematic review did show that there are two major disasters that are reported in the literature over the last 30 to 40 years or so. 97% are due to COVID and 88% are due to earthquakes. But the impact of these disasters is different on the blood supply system. So for instance, COVID, we know from yesterday that it impacts negatively on the blood supply because of the donor fear and all the complications and the difficulties in collecting blood during the COVID pandemic. On the other hand, earthquake systems are associated with increased number of donors after earthquakes, and that's a normal, natural response that can happen following such a disaster. And that's especially from first-time donors. So it has been observed in many publications that the number increases. The other important things that we need to really take into account from this publication is that in this systematic review, none of the papers did discuss plans in managing disasters. And this is important, and we have to really think about this, really taking it back as a learning lessons for our healthcare systems. So what are the needs as per this paper is we need a risk modeling system to optimize the efficiency of the blood supply chains. We need also to have data on seroprevalence and hemovigilance, and this should be coordinated in conjunction with the public health surveillance to optimize responses to the threat of emerging infections. And the example is seen with, for instance, COVID as well as dengue and so forth. So what are the factors that can negatively impact a healthcare system during a disaster? A fragmented blood system is a negative, it can have a major negative impact on a management of a disaster. if there's a lack of collaboration between different stakeholders that further augments this issue, if there are fragmentation of the procurement of consumable, and I learned yesterday about the excellent system that is present in here in this perspective that can overcome this limitation. Interruptions of the regular supply of the test kits, reagents, and consumables, and we've seen that during COVID, for instance, where we ran out of test kits as well as masks. Lack of centralized reference laboratory system for evaluation and validation of test kits and reagents. So we know that there are countries that had to basically locally manufacture test kits, but you need to also have reference laboratories so that you can validate them. Damage and disruption of the healthcare facilities, water and electricity supplies and sewage system, and that can lead also to increase in the rates of different infections that can impact your donors as well as your staff members. And then the other important thing is the damage of the communication network and displacements and death of healthcare worker. So example of this is actually in Lebanon. So when a couple of years ago, there was this major blast that took place in one of the ports. Actually, a full blood bank have collapsed with all the donors and all the patients and the staff that were in there. So you could imagine how can you handle a system like this whereby your facility actually collapsed during the disaster with whoever is in there. So when we talk about hierarchies and plans and action plans in this, it's very important to think of it that you are part of the bigger system and you have to be there, you have to be part of the bigger system. So on a national or a sub-national or local level, this is basically where we would all be. That has to be within what is the plan within the Ministry of Health, and the Ministry of Health plan is part of the larger plans that is considered really a national plan. And this is typically a plan that is run by the Ministry of Civil Defense or the Office of the Prime Ministers. And so the transfusion emergency preparedness should be really embedded within this larger emergency preparedness and response framework. So an example of this, for instance, in Oman, so we do have in our hospital disaster plan, and this disaster plan is really run by the hospital, but this disaster plan is also within the larger plan that is under the Ministry of Health. The Center of Emergency Management is under the Ministry of Health. It acts as a centralized location for the coordination and the control of health-related emergency response activities. The center has the mission of establishment of a comprehensive, effective, and integrated health emergency management system with allied sectors for achieving immediate and effective disaster response to reduce the impact of any consequences of the disaster. So it does that in an integrated way in collaboration with the different health response teams as well as hospitals. So the center coordinates also with the National Committee for Emergency Management and the other stakeholders. It is very important that it get activated quite early in a disaster to ensure readiness of the government's health services to prepare in response to the health emergencies. It also makes sure that there are emergency operating system rooms that are activated in all governments to guarantee optimal preparedness and response for a national disaster. It also determines the basic requirements for effective response and coordinate and liaise between the different stakeholders during the management of a disaster. So thinking about that then, that's what is present in your Ministry of Health. How would you be embedded in that plan? And I think this is very important because not in every country the transfusion medicine is embedded within the national plan for disasters. And it's very important to be proactive and to bring that to the attention of the decision makers of why we have to be there. There's a need to nest it within the bigger picture, and also we need to be aware of what is the national plan. And so it's very important for those working in the hospitals and in the transfusion field to understand how the activation takes place and what are the actions that take place from their side. And it's very important also to think that there are other things that impacts the disaster responsiveness. So there's an important role of media. There's also an important rules of the community and its action. There's important rules of the NGOs, and there's important rules of the suppliers. So within that plan, there are multiple stakeholders as well that have an important role to ensure effective response to a disaster. So when it comes into disaster risk reduction, things that are important to think about when we are working on a plan is that you have to build that at every level of the transfusion continuity of care. What would you do with regards to transfusion? And what would you do with regards to donation? And what would you do also with regards to supplies, consumables, safety of patients, safety of donors, and safety of your staff? You need to identify the risks as well as the critical services that needs to be supported during the middle of a disaster. The system has to be very resilient and ready for any changes in the disaster because disasters do have different impacts and that can take a couple of days. So the system needs to be flexible and resilient and know how to act accordingly. There has to be a plan. That plan needs to be educated to all of the staff, debriefed, tested, and so forth. And that plan needs to include a recovery phase, which is very important to bring in the business back to normal once the disaster is overcome. And there is an important coordination that is required between the different institutions. And so there are many resources that are available out there talking about disasters. There's a new guidance that came from the WHO, which I will allude to in this presentation. It's mainly specific on how to ensure sufficient supply of safe blood and blood components during emergencies. However, there are other publications that comes from the WHO specifically speaking on national disasters from a healthcare system and how to manage them. There is one full publication just dealing with communication and how to control communications during emergencies and disasters. And there are other resources that are available from AABB as well as other national blood authorities. And all of these are open access, so you can find them really on the net. So if we look into the disaster management, it's a cycle of recurrent events with 4 phases. There's a mitigation phase, there's a preparedness phase, a response, and a recovery. The mitigation is really, and the preparedness is really before a disaster. That's planning for a disaster itself. The response phase happens during a disaster, and the recovery happens after the disaster. And as I said, this is really within the National Action Plan of Health Security that is embedding this response within their healthcare. And the whole process is really reflected with every system in your healthcare. So speaking to the first phase, which is mitigation. Mitigation means prevention. You have really to think about your system in order to minimize the impact of the disaster itself. So this includes, for example, your main building. You need to have a periodic inspection of the main building structure to determine its condition. Is it good in the case if there is an earthquake that happens, or if there is a flooding, does that going to impact your equipment, your blood supply, your blood stock, and so forth? For instance, we were building our new bone marrow transplant center, and I remember we had a discussion that we will leave the laboratories and the blood bank on the 2nd floor, because in the event if there is any flooding, then we don't really lose all our stocks of blood and consumables. There's very importantly to inspect the infrastructure and the essential system, the water, the electricity, the communication system, and the internet. Assessment of the emergency and the evacuation systems, for example, the emergency exit and the extinguishing location. Management of medical resources, so you need to have stocks of supplies and consumables available all the time for a period of about 3 to 6 months in the event that the disaster happens. You need to have a connection of critical equipment to emergency socket, electrical supply. You need to have efficient availability of human resources in the event of a disaster that you can act immediately. You need also to have health and safety regulation to be activated in the event of a disaster. It's very important to engage in this phase with the higher management, and it's really to have that really prior to any disaster happens, God forbid. Collaboration of the blood transfusion service with the environment and the private health sector is very important. Who will be backing up your blood supply in the event that you can't get any donors? What is your backup system for your blood stock in the event you had emergency flooding your blood bank? Where would you shift all your blood? All that requires really having agreements earlier on with backup institution within your healthcare system, of course. List of key local and state government authorities and organizations to contact in the emergency. This normally happens at a higher level within the institution. Financial planning, required funds and the different resources for that. Planning of the community support and engagement. Communication plan has to be there as well as part of your plan. Procedures of cybersecurity and digital healthcare service is very, very important. And this is, I can't really emphasize this. There was a full conference that I attended in Turkey just talking about cybersecurity in blood banks and how to really have a system to prevent blood banks from getting cybersecurity attacks. This is all part of just planning in the event there is a disaster. Preparedness includes different aspects. So technically, there is an internal emergency and a disaster committee. And within the system as well, you need to have the procedure written and a full plan with flowcharts of how actions will be done. You need to have a business continuity plan on how to restore your routine operations once the disaster is over. There has to be a mutual agreement with other institutions and countries potentially, and this is very important in the event that the disaster is really on a national level. And you need to have a donor database with contact numbers and emails to reach out for an emergency. With regards to information system, there has to be a list of any important equipments and softwares that are needed. You need to have record management procedures for medical, personal, financial, as well as backups of these. Supply chain strategies, and this is really very important, especially with the different suppliers and distributors for your consumables, as well as for your first aid items. And then the thing that we always think about is also how to maintain the safety of your own staff while they are doing their own performance. So I know, for instance, in Dubai, when the flooding took place last week, there are staff that couldn't really leave their institutions because of the degree of the flood. So they ended up being overnight in the institution in order to ensure their safety, but also to ensure continuity of the service that they were providing in that healthcare system. And then education, training, as well as regular drills is very important. You need to have your staff prepared anytime for any disaster, and you have to have a regular review and updates of all these plans. So this is usually done at the level of the institutional committees as well as within the larger committees within the Ministry of Health and on the national scale. Now, with regards to the blood emergency plan, what should you do? So I think it's very important to think about donation, transfusion, consumables, and staffing. All these need to be there. It's recommended to have cutoffs of what you consider as your green inventory, amber inventory, and red inventory. In our institution, for instance, we do have a setup whereby we define these, but we also have a separate stock of blood that is considered a disaster stock of blood, so that in the event of a disaster, I do have something in place all the time for managing disasters. Triage procedures and blood requests is very important, in line with what was presented on patient blood management, with thresholds and frequency of transfusion for patients who are on regular transfusion. And application of patient blood management is really very important in there. And if you have that in the system, then you're fortunate because you already have it in place. Other thing is how you manage your donor sessions and campaign. How can I recruit donors in the middle of disasters? Do I have a walk-in donor program of donors that are pre-tested and we know that they are serologically negative in the event of requirement of blood? Can I get supply from patients? Can I get supply patients' relatives or even from hospital staff that are working in the hospital? And as I mentioned yesterday with our COVID pandemic experience, we've seen a lot of support that came from military personnel to blood donation. So what is your backup system in the event of a disaster? That all has to be very clearly defined in your plan. And you may need to change your donor eligibility criteria in the middle of a disaster. You may basically lower your hemoglobin cutoff, and WHO did release a guidance during COVID to allow, donors with lower hemoglobin to donate blood, and that's because of the criticality of maintaining blood supply during COVID that was seen. So there might be a requirement that you have a legal framework to allow coverage in the event that you need to change your donor eligibility criteria in the middle of a disaster. And then do you have a system for using whole blood, or should I consider whole blood in the middle of a disaster? And that's usually used in the event of military type of traumas, but now it is very commonly used in civilian trauma, especially in the North America and the United States, and some countries in Europe as well. So do I have a system that allows that in the case I needed it? The other aspects is how to maintain assessments of stock and consumables, transportation of blood and blood components, transportation of staff and donors, and then internal and external communication strategies. And it's very important to remember that you should not only have that only written. So the staff need to be involved. They have to read through it. They have to go through the process of practice. And you also need to have a system with collaboration with others in the institution on how to back up your staff in the event you needed to have extra coverage. And we've had that during COVID, for example, where we need to send some of our staff to the microbiology laboratories to help with the molecular testing for COVID patients. So I said this is a very nicely written guidance from the WHO with communication. And you really can't imagine the number of stakeholders that you need to have a communication path with in the middle of a disaster. And this communication path has to be also present in different type of languages. So what we have back home in Oman is we have a platform for communication with the public, with the event and feedbacks on what's happening in the middle of a disaster, and that goes with different languages. It's not only Arabic, it's not only English, but it goes in other different languages. We also do have a system whereby in the middle of a disaster, for instance, if there is a flooding that's going to happen, all our phone systems will really send in an alert in different languages automatically. So that goes as a mass messaging to all of the citizens who are registered with the different telecom communication systems to get an alert about the disaster. And that has to be in different languages that are common in your country. So when it comes into the response in the event of the disaster, it's very important to think about the key products that need to be continued. What do you need to address? What do you need to supply at that time? And what do you need to reserve? And you need to coordinate this with the incident management system to minimize any adverse impacts on your patients and services, because you don't really know how much of stock you're going to have and how you will be maintaining it and for how long. For instance, what happens in Turkey when the first earthquake did strike, the second earthquake did follow really in less than 24 hours. By that time, the blood banks were flooded by donors that were donating blood. So you can imagine really the risks that are associated with subsequent disasters that are happening to your donors who are trying to help and support the system. And so you need to have a system to minimize the impact of that on the organization and the preparedness for the recovery. And there are different grades for the severity of any disaster. This is as per WHO grading. We have two different types of gradings that can be institutional or national, but this is what's recommended by WHO. So level 1 is really what is considered minor and local, i.e. it is basically local disruption of the products and the service delivery. Level 2 is a significant type of disasters, usually as a province rather than local, that leads to disruption of the products and the service delivery. Level 3 is something that is national, and level 4 is something that is larger than, something that can a country control by itself, and it requires international collaboration and help and support. So when we activate the disaster plan, there has to be systems for activation by an authorized staff, and this can be institutional versus national. There has to be an internal emergency committee that should be convened, and the list of people in this committee is already predefined in the disaster plan. Local representatives and regional representatives may be called to meetings with other committees that are on a national level. And there has to be a continuous, delegation of responses and responsibilities as per the disaster plan to everyone until the recovery phase takes place. So you could see here that this is really also is dependent on the level of the disaster, whether if it is local, whether if it is provisional or national, whether if it is something that is more major. So this gives us examples of what can be done with regards to the blood supply. For instance, if it is a level 1, then that can be managed between the institutions and basically moving blood and stocks between different hubs and transfusion services. But if it is larger than that, then you need to have support from other organizations. And if it is larger than that, then you may need to have support also from other countries. And there has to be charts that activates really or show the demand and the command activation and response and responsiveness within this. And it all has to be predefined really earlier on in the plan. So with regards to donations, it's very important to utilize social media and also to do targeted collections and calling donors. To ensure safety of the donors as well as throughout the donation, consider extending opening hours and altering of the donor eligibility criteria. I'm finishing, yeah. And you can see here that these are different examples that we have seen through different types of disasters. Finally, coming on into the recovery phase. The recovery as after the disaster, returning the business back into normal. This has to be coordinated with and overseen by the senior leadership, and there has to be clear responsibilities on who is responsible in what part, and basically helping to return everything as soon as possible after the disaster. And it's very important to learn from these lessons that are learned during the disaster and help in improving the plans for future disasters. So in conclusion, disaster plans are very important. It has to be clear, it has to be documented with clear responsibilities defined. There has to be a lot of multidisciplinary coordination and collaboration. The transfusion system response should be embedded within this national healthcare and emergency response system. Comprehensive emergency plans should be regularly reviewed and practiced, and effective and donor communication is very, very important in order to minimize harm and to also recover a country from a disaster. With that, I would like to disclose and thank you very much for your attention.